the potential of the quantitative EEG are numerous, are huge, because we are just starting to scratch the surface of these possibilities, because quantitative EEG techniques are different and various. We have spectral techniques, which are the most common technique that were used for pharmaco-EEG. They were used mostly for antipsychiatric medication evaluation. So for example, for antidepressive treatment or for antipsychotic treatment evaluation using EEG. And they were the most common form of analysis. Then we have the connectivity analysis, which evaluated that there are various techniques, but they usually evaluate the range, the higher grade of connectivity between electrodes or between brain region using more advanced techniques. In our case, we used a low density EEG, which is the EEG which is used in clinical practice in every epilepsy center. This grants two great advantages. The first advantage is that this technique can be used in every epilepsy center because it is quite affordable. It is not expensive. And secondly, there is a huge amount of data, because every patient usually is referred for the EEG after a suspected diagnosis of epilepsy. So we have a huge amount of data, which is the first requirement for machine learning, and also we have a technique which is not expensive. So we have just started to see the applicability of this technique in a relatively small sample of patients. We analyzed 23 patients and other 9 patients in a second time to validate our findings. So there are relatively few patients. In order to do a reliable machine learning algorithm, we need a huge amount of data, a large amount of patients, a large amount of EEG, and most of all, we need to evaluate the effect also on other anti-seizure medication, because until now, we've just evaluated levetiracetam, which is, of course, one of the most commonly prescribed anti-seizure treatment, but we need to evaluate also the effect of other anti-seizure treatment, especially sodium channel blockers medication, because they are the most common, the most efficacious, the most useful medication for patients with focal epilepsy. So the second step in our project, in our future development, will be to evaluate if the machine learning algorithm could first differentiate between seizure-free and non-seizure-free even before starting the treatment. And then if this algorithm could also help us to do a personalized choice in the treatment of patients with epilepsy. So it could suggest us to use a specific treatment for that specific person with epilepsy. For example, use the sodium channel blocker or use levetiracetam, for example. But there are a large amount of anti-seizure medication with other mechanism of action. So we are going to evaluate each of one of them.